Welcome. My name is John Pilcher. I'm a bariatric surgeon in San Antonio, and in this video I'm going to talk about some potentially difficult family dynamics. Two of my recent videos were intended to give people some information and perspective about areas of hesitation around bariatric surgery. One of these videos was about the cost versus the benefit of bariatric surgery, and the second video was about the risk versus benefit of bariatric surgery. And I put them together because I see that reasonable, intelligent people can have doubts about bariatric surgery. For better or worse, there's often another level of decision-making beyond the person who's suffering from the obesity disease, and that's on a family level. And this can be great because when it's working well, bariatric surgery works as a team project. And so ideally, when bariatric surgery is appropriate, the loved ones are also on board and actively supportive. However, many of my patients themselves have an appropriate sense of conviction in favor of bariatric surgery, but they face significant resistance from skeptical loved ones. Most common spouses, but they can also be parents or children or co-workers. Now, usually these skeptics do have the best interest of the patient at heart. In those cases, a logical presentation of facts and pros versus cons should help them come around so that together a mutually agreeable decision is reached. However, sometimes the skeptic has deeper beliefs or concerns that prevent them from getting on board with the bariatric surgery, and this is where it gets sticky. They may phrase their objections in the form of risk or cost or time or other practical issues, but for these folks, the practical objections may just be a smokescreen for deeper concerns that are supposed to remain hidden. And I don't have any brilliant ideas about how to explore and address these, but I think if I describe them, they'll be a little bit easier to detect. And then you may want to consider counseling or family therapy to try to bring these issues out and engage them in the most constructive way possible. One of the problematic dynamics is when the family member is locked into the obesity as a choice narrative. And this may show up, the family member points out that, well, if you do a perfect job, you lose weight, and you never do a perfect job on your food plan, or things along these lines. The obesity as a choice narrative believes that people are 100% responsible for their obesity condition because according to this narrative, they have control over what they eat and their physical activity. We know that the science says that this is a hormonal and biological thing, just to be clear. But for these people that believe in obesity as a choice, it can actually be morally wrong to seek medical assistance for this obesity problem. So this is a tricky one because it falls into the level of belief and not logic, so it can be very difficult to tease out. A different concern that may be mixed in with that obesity as a choice belief, or it may stand independently, is a very unfortunate situation where the skeptic may like the status quo in the relationship where the person suffering from obesity is in a way subordinate. And they feel uncomfortable with the idea of the person with obesity becoming more healthy and more self-directed and more confident because they don't want to change the power dynamics of the relationship. I want to be clear in this regard that you as a person deserve the best possible health and the longest possible healthy life. So in the end, I hope this gives you information to understand what the decision dynamics are in your home, and so that you can help these decision dynamics to work in the way for your best support for your decision with or without bariatric surgery. I wish you the best of luck on your journey.